This is Radio Health Journal. I'm Nancy Benson. This week, how a severe emotional shock can sometimes be fatal.
We don't know that this is stress cardiomyopathy at initial presentation. It looks just like a heart attack, and we treat it like that until we know otherwise.
Proof that people can die of a broken heart when Radio Health Journal returns.
I'm Reed Pence, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like Viewpoints, our sister show covering current affairs.
This week on Viewpoints.
I approach the internet now as a tool. It is there to help us access information, to connect with people far away, and I came back with that view.
And it changed her life. We'll find out how.
Then, Churchill, Roosevelt, and the Pearl Harbor Christmas.
All that and more this week on Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
Just about a year ago, actress Carrie Fisher died of a heart attack. Her mother, actress Debbie Reynolds, was grief-stricken and died herself the very next day. Her son, Todd Fisher, said she died of a broken heart. You hear about those kinds of deaths occasionally. Spouses who've been inseparable for 50 years may die just hours apart. And you may wonder, is it possible to literally die of a broken heart? The answer is yes.
The prevalence of this is sobering. Maybe we're recognizing it more, but about 1% of heart attack-like presentations is stress cardiomyopathy. And that's not insignificant.
That's Dr. Tracy Stevens, a cardiologist at St. Luke's Mid-America Heart Institute in Kansas City. She says stress cardiomyopathy is only rarely fatal, but it's still a real condition that most people call broken heart syndrome.
Often the scenario is in a person who hasn't had any history of heart problems and really has been pretty healthy, no risk factors that traditionally lead to buildup of plaque in the artery. What is a common part of their history is this person has had a recent severe stress. And interestingly, far more common is it women than men. It's not unheard of in men, but it's far more common in women.
Often these women show up in the emergency room with symptoms that are just like a heart attack.
It can be chest discomfort, shortness of breath, jaw, arm, pain between the shoulder blades. So really, very commonly, it's the traditional heart attack symptoms. Their EKG, the electrocardiogram, can look abnormal just like in a heart attack. We often measure a blood test, a heart enzyme test that's a marker for a heart attack called the troponin. And often in this stress cardiomyopathy presentation, the troponin's up as well. So we don't know that this is stress cardiomyopathy at initial presentation. It looks just like a heart attack, and we treat it like that until we know otherwise.
Stevens says doctors figure it out when they try to find the assumed blockage in heart arteries and come up with nothing.
When we're concerned that this person is presenting with a heart attack due to a blockage in one of the coronary arteries or multiple coronary arteries, which are like the gas lines to our engine, our heart, what we often do is emergently take them to the cardiac catheterization lab where we perform a coronary angiogram, or commonly called a heart catheterization. We inject dye into the coronary arteries. And in a good old America-type heart attack where it's plaque, buildup, and clots that often need a stent or sometimes bypass, if that's present, then that's not stress cardiomyopathy. How we learn this could be stress cardiomyopathy is by, first, this heart catheterization shows the coronary arteries are fine, that there's no blockages there, cutting off flow to the heart muscle.
Doctors then do an ultrasound of the heart. If it's broken heart syndrome, they'll see that the heart's main pumping chamber isn't working right.
The appearance of the left ventricle with stress cardiomyopathy is a very often classic appearance where just the base of the heart is contracting, but the rest towards the apex balloons out. And so the strength of the heart fails in this scenario. And that's how we make that diagnosis.
Long term, that can turn into heart failure. However, Stevens says most patients recover.
We treat it with rest, reassurance, and close follow-up. Because there's been a severe stress on the heart, we often think of one or two medications that help take the stress off the heart. One family is the beta blockers. They block the adrenaline effect in part to the heart muscle, which allows recovery. As you follow these patients, their EKG has this really interesting transition to turning very abnormal to then going back to becoming normal. And then if we were to follow the ultrasound of this person's heart, the heart recovers pretty quickly and often well within a month, and it's back to functioning normally.
But how can emotion turn into heart attack symptoms in the first place? Doctors believe that broken heart syndrome is a result of the heart being stunned by stress hormones soon after a traumatic event.
One of my colleagues just had a lady who was out walking her dog, and the dog got caught in a raccoon trap. And that severe stress from not being able to help her pet brought on these symptoms. I just had a lady who was driving down emergently to see her sister who wasn't doing well, and while driving had the onset of symptoms. Another lady's husband had sudden death, and at the service she had the onset of symptoms. And it doesn't have to just be emotional stress. It can be physical stress. I just had a young woman who had her gallbladder out and in the recovery room had the onset of heart attack-like symptoms.
However, broken heart syndrome isn't really a heart attack, but there's one other way a strong emotional shock can produce those symptoms. That's when the flood of hormones prompts a genuine heart attack.
We know with stress, if there's plaque in our arteries, the adrenaline can rupture plaque, and then that can cause the good old America heart attack. And the only way we know if it's that or this broken heart syndrome is when we do the coronary angiogram or the heart catheterization to lay out the roadmap in those coronary arteries.
Perhaps that's what's at work this time of year to produce annually high rates of what doctors call holiday heart attacks and Merry Christmas coronaries. Anytime there's a strong emotion, it's a risk. Sports fans may experience it too if they live and die with their teams. Stevens says she saw it a few years ago when the playoff fortunes of her hometown Kansas City Royals turned on a single play.
I was on the ICU service at that time. That evening, we had a disproportionate number of people coming in with heart attacks, true America heart attack obstruction of the arteries due to plaque, who in each one they said their symptoms began following that wild card game and that pivotal play. So it wasn't that the Kansas City Royals caused plaque buildup, but the surge of adrenaline that went through the bloodstream when there was plaque present ruptured the plaque and caused the heart attack. And we can see that in community disasters, earthquakes, tornadoes, hurricanes, a disproportionate number of people coming into the ER with heart attacks that are due to plaque rupture.
Doctors are much more aware of stress cardiomyopathy than they used to be, but no one can assume heart attack symptoms are due to one type or another. The advice is still the same: call 911 immediately. Our production director is Sean Waldron. I'm Nancy Benson.
Medical notes this week. A number of studies have found that people who drink diet soda end up gaining more weight than people who drink higher calorie beverages. Now a study in the journal Current Biology explains why. Researchers say that a food's sweet taste is just as important as its calorie count as far as your metabolism is concerned. In most foods, sweetness indicates high energy, but in artificially sweetened foods, there's a mismatch, so the brain is confused. Diet foods trigger the metabolism to run as if the food contains many more calories. Pregnant women who contract a fever in their first trimester have a risk of delivering a child with heart defects or facial deformities. Researchers have known of a connection for years, but didn't know if fever itself was the cause, or the virus or infection that caused it. Now a study in the journal Science Signaling concludes it's the fever. Doctors say acetaminophen is safe for pregnant women, so they shouldn't hesitate to consider taking it to reduce fever. And finally, science has come up with the answer as to whether cats or dogs are smarter. And the answer won't please cat owners. A study in the journal Frontiers in Neuroanatomy finds that dogs have significantly more neurons in their brains, the little gray cells, associated with thinking, planning, and complex behaviors. Dogs have about 530 million cortical neurons, researchers say, while cats have about 250 million. That compares with about 16 billion in people. And that's Medical Notes this week.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.